Today we're going to take a look at viral hepatitis. Viral hepatitis is the most common liver disease. There's viral agents of acute hepatitis that are divided into two different groups. We got primary hepatitis viruses, which is what we're going to spend most of our time on today, the A, B, C, D, E, and G, which account for 95% of the cases of hepatitis. We're going to look at secondary hepatitis, which can be caused by something else like Epstein-Barr virus, cytomegalovirus, herpes virus, or others. Usually it's the result of having another issue that causes the hepatitis. This can be acute or chronic. We have 4 different types. The first one is acute. And just like everything else that we've learned is acute, it's something that comes on quickly and usually doesn't last too long. So acute is, you could have an incubation phase, a pre-icteric, icteric, and convalescent phase. Okay, so pre-icteric and icteric, if you remember those terms from clinical chemistry, refers to having a yellow color or a yellowness to it. So if we have an icteric serum sample, it has a yellowness to it. The incubation can range from a few days to as many as a few months, and usually the average length of time is 75 days in hepatitis B. We can also have fulminant acute hepatitis. This is a rare form of hepatitis that's associated with hepatic failure. Subclinical hepatitis without jaundice. This usually accounts for patients that have antibodies in their serum, but they really don't have an actual hepatitis going on. Chronic is something that happens for at least 6 months or more. So it's a hepatic inflammation and even necrosis. This is usually only about 10% of the patients with hepatitis B virus. So we're going to start walking through each one. Let's start with hepatitis A. This is the one that you see a large, like it'll be an outbreak when a restaurant, ooh, that restaurant has hepatitis and all the patrons got it and the worker had it and things like that. So when you hear about hepatitis on the news and it's food or restaurant related, it's usually hepatitis A. Hepatitis A is a small non-enveloped RNA virus with a nucleocapsid, and it acts as a hepatitis A antigen. The replication of hepatitis A is only in the cytoplasm of a liver cell called a hepatocyte. So only the hepatitis virus that has been able, and it's the only one that can be grown in a culture. We find this one transmitted by fecal-oral route. So usually it would be if an employee at a restaurant were to pass this on to people who are eating, maybe they have poor hygiene. When they're working at the restaurant, they get somehow get feces on the door handle. It ends up, on other people's hands, ends up in their food, or they're holding their sandwich, goes in their mouth, those types of things. And usually this occurs when there's an early phase of the acute illness, and since the virus is shed in the feces for up to 4 weeks after infection. So if you have hepatitis A, you can pass it on to other people for 4 weeks. So you might be pretty early on, not know you have it, and be passing it on to other people. Usually there's infected food, contaminated water, or eating raw shellfish is where we would find this. With this one, we look for, when we draw the patient, hepatitis A antibodies, because the hepatitis A IgM appears within 4 weeks after infection, up to 4 months after infection. If we see IgG with this as well, it means that they've been infected in the past or they've received the immunization. Sometimes when you go to visit other countries, they may, offer you a hepatitis A virus shot before you go to some other type of third world country to try and protect you. Prevention is obviously filtered water. Chlorinated would be best. Vaccinate yourself if you're going to go overseas. The next one is hepatitis B. This is the only one that's a DNA virus. We call this the Dane particle. There's a surface antigen and an inner core antigen that we look at, the S and the C. The DNA is in the inner core and is in a circular double-stranded, and it's double-stranded, but it's one of the strands that can be incomplete. So viral DNA is incorporated into the host DNA during an infection. This one can be transmitted through blood, body fluids, sexual contact, or contaminated needles. It can also occur in settings where there's continuous close personal contact, such as skin lesions, sharing toothbrushes, razors, getting bitten. We find it in saliva, semen, breast milk, tears, sweat, and other fluids. But stool is not infectious like hepatitis A is. This is the one that we'd probably hear about most common when someone has a hepatitis A that is more long, or B that's more long lasting. Some of the signs, we see a broad range of liver disease. It can be a subclinical infection, and it can be acute or fulminant hepatitis. You can also be an asymptomatic carrier, and it can become chronic hepatitis cirrhosis or liver cancer even later in life. A persistent hepatitis B infection is thought to be the precursor of a primary hepatocellular carcinoma. So again, this can lead to cancer down the road. We see jaundice and abnormal liver enzymes. Usually the AST and ALT are extremely elevated. You can actually see the jaundice in this man's eyes here. So we use a lot of lab assays with this one. We can tell a lot about what part of the disease this patient is experiencing based on what the level of each of these antibodies are. So we're going to talk about each one and what they do. So we have a hepatitis B surface antigen. We just talked about that. That is the main part of the hepatitis B. So that is what is actually actively making you sick before you even have any antibodies built. Hepatitis B surface antigen has to be there first. Okay. Then we have a hepatitis B E antigen, which indicates, high replication going on. We'll talk about that in a second. Then we have a core antibody. Okay, so we got that core piece that we talked about. Once you start making antibody to that core, that's, obviously going to help you fight it off. We have a hepatitis B E antibody. We have a surface antibody. And we can also determine if they have hepatitis B by PCR testing. So we're going to look at each one of these individually because you do have to know the difference and why certain ones would be elevated in the patient's bloodstream. Okay. First one's hepatitis B surface antigen. This is what's going to physically make you sick. Okay. So this is a detectable marker found in the serum during the incubation period. So right away, 2 weeks to 2 months. Usually they're going to have clinical symptoms. We screen for this when we have blood donated. Okay. And it also indicates active hepatitis B infection. So that one is stating that you are sick and you can pass it on. Okay. Hepatitis B E antigen is found in the serum of some hepatitis B surface antigen positive patients. This indicates that there's highly active viral replication going on. It's really not found in the absence of hepatitis B surface antigen, but it's a reliable marker for the presence of high levels of virus and high degree of infectivity. So in this case, you really want to keep people away from others. Next, we have the hepatitis B core antibody. This is an indicator of a recent infection. So you have the hepatitis surface antigen and the E antigen, which say that you're actively sick, but just after that, you're going to have a rise in this core antibody. So it's pretty recent, okay? This will occur in the hidden antigen phase of hepatitis B. This is in between where the surface antigen disappears and the antibody starts to appear, okay? So you're going to have this kind of right in the middle. Antibodies to hepatitis E antigen and B surface antigen develop during convalescent and recovery from hepatitis B infection. So once you have the E and the S antigens, the antibodies are going to come in, right? Because you have to have the antigen before the antibody. So we're going to have the anti-hepatitis B E and the anti-hepatitis B surface. Those are going to occur after the infection is gone to help prevent against future infections. So the development of the anti-hepatitis B E in acute hepatitis is the first evidence that the convalescent stage is starting. The anti-hepatitis B surface or hepatitis B surface antibody, be called either one, usually occurs during convalescence, so it's recovery and immunity. That is the major protective antibody in this disease. So I'm going to go back to that for a second here. When you get the vaccine, okay, that you have all had to have to be in the MLT program, your body was given a dose to create the anti-hepatitis B surface. So you and I should all have anti-hepatitis B surface antibodies in our body to protect ourselves from getting it. So this anti-hepatitis B surface or hepatitis B surface antibody, remember they're interchangeable, mean that you could have received the vaccine or you could have had hepatitis earlier in life. So we can also look at viral DNA. We can do a quantitative assay to monitor therapeutic responsiveness for someone who's being treated. And you can do a qualitative assay to confirm that the infection, that that the patient has infection. Usually we test for the antibodies and antigens specific to hepatitis B to kind of see where they're at with the disease and when they could have gotten it. When you have an acute hepatitis B infection, your hepatitis B surface would be positive, which is a diagnosis of acute hepatitis B. After that, the anti-hepatitis C core is the first antibody, and the IgM anti-hepatitis B core would indicate acute infection. IgG hepatitis B core means that you're in the recovery phase. Okay, so that's nothing new to you guys. You've learned that IgM is first, IgG will come in later. The hepatitis B antigen also becomes detectable in an acute infection and is a marker of that replication, which we talked about already. So in an acute infection, patients are most infectious when we see the E antigen, and it disappears before the S antigen. Okay, so that goes. Now, when someone's chronic, the viral DNA is actually incorporated into the DNA of their liver cells. This leads to the development of liver cancer. Could be, which is also called hepatocellular carcinoma. The immune response to the viral antigens leads to cell necrosis. So necrosis means tissue death. Okay, so that is not a good scenario. This chronic hepatitis B infection occurs in two phases. So there's a more infectious replicative phase where we see high levels of the hepatitis B virus DNA itself and the hepatitis B E antigen. Then we have a minimally infectious non-replicative phase, which is an undetectable hepatitis B virus DNA and hepatitis B E antigen. You can't detect those, but we do see some hepatitis B surface antigen, anti-hepatitis B E, and some hepatitis B virus DNA in the hepatocytes themselves, or those liver cells. Hepatitis B surface antigen remains detectable for more than 6 months when there is a chronic infection. And the hepatitis B core is present in all chronic hepatitis B infections. Then you can become a carrier. So with a carrier, we see anti-hepatitis B E in the serum and are at a much later phase of the infection. The anti-hepatitis B E carriers are less infectious, but they still can transmit blood through blood transfusions. These hepatitis B surface antigen positive carriers will become anti-hepatitis B E positive carriers at a rate of about 5 to 10% per year. All of those hepatitis B surface antigen positive carriers must be excluded from giving blood for a transfusion. So 1 in 4 carriers have hepatitis B E antigen in their serum and are most likely have recently became carriers, and their blood is usually highly infectious. So how do we prevent ourselves from getting this wonderful hepatitis B virus that we're spending so much time on? Well, to prevent it, we have transfusion-related acquisitions, which means we donor screen, we interview, and we use blood and blood products that have been tested. The vaccination's 80 to 95% effective, and hepatitis B immune globulin can be given to people who have had an accidental needle stick. It's also given to infants born to infective mothers, so we're actually giving them, it's called HBIG, hepatitis B immune globulin, which is the actual antibody just passively given right to the patient. Treatment, we can give interferon A or intron A, which is an antiretroviral nucleoside drug, and when it gets severe enough, sometimes a liver transplant, although the new organ will probably become infected with hepatitis B as well. All right, hepatitis C virus is the next one. And this one I always, for some reason, I always thought of Pamela Anderson because I believe she had it. So this is usually spread by blood or blood products. Injectable drugs are the major factor for this, so people that are sharing needles. 10% are just sporadic. It's not really frequently an STD. It can progress to cancer just like hepatitis B can. It's it's progressive, but it's very silent. It can have a high ALT, and we treat that one with interferon. Hepatitis D is known as the Delta virus. This is for people that are affected with hepatitis B virus. You can't get hepatitis D without having hepatitis B first. It is severe and a rapidly progressive liver disease, and there's no therapy. It's spread by direct contact of hepatitis B surface antigen carriers with hepatitis D virus, hepatitis B virus infected individuals. We screen for hepatitis D virus antibodies in those hepatitis B individuals. So hepatitis E is the last one. This one was discovered only recently in travelers, usually from a third world country. This is the fecal-oral route, just like A, and it's usually because of poor water sanitation. We find anti-hepatitis E virus, either IgM or IgG, depending on if it's acute or chronic, or if you're in recovery with that. Sorry, the last one's hepatitis G. The hepatitis G virus is very new, and it's closely related to the hepatitis C virus. It's bloodborne. It's usually IV drug users, and very commonly 1 to 2% of the donors have hepatitis G virus RNA in their serum. It's been proven to cause fulminant hepatitis. It cannot even replicate in the liver. The role of hepatitis G virus in acute and chronic hepatitis is not fully understood. So that concludes our section on hepatitis.